I'm gonna be really mean because it's something that you do for a living, and I'm gonna
Okay.
ask you to encapsulate it in like 5 minutes, okay?
Sure.
But one thing that you mentioned that you do as you're consulting is like positioning for medical practices, right?
Yeah.
And I've got you as an expert here. I feel like it would be a disservice to the audience if I didn't ask at least a little bit about that, right? What's the kind of your best advice for taking care of positioning, or the biggest mistakes, or anything that you reasonably share in the few minutes that we have left?
Sure, yeah. So ultimately, like positioning, what I tell folks is like positioning is just identifying what you do, your specialization in your target market, right? Like we do X for Y. So maybe it's we deliver physical therapy for, post-surgical knee replacement patients or something like that. Um, the complicating factor in healthcare is that it's not just you and the patient, right? There's four different stakeholders in healthcare. We call them the four Ps, right? You've got the patient, the provider, the policymaker, and the payer. So, depending on who you are communicating with, each one of those stakeholders views or values something different in the care relationship. So when you're considering positioning your offering or creating your value proposition for your market, you really need to take into account like who ultimately is the economic buyer of my service, and how am I communicating the value that my service provides to that economic buyer? Because, for example, if your patient has private insurance company or Medicare or something like that, the economic buyer for that decision, oftentimes, the patient is the end recipient, but they're not bearing the financial cost a lot of times. They're maybe 20%, maybe 15%. The real the real person who's paying the bulk of that cost is the payer. So you need to find a way to communicate the value you're creating to that payer in a way that that payer is going to say, okay, we're gonna pay for it. The same thing if you're developing a piece of technology or a piece of software. Like there's end users and there's economic buyers, and you want to be able to, one, clearly understand who the economic buyer is, what they consider valuable in that healthcare exchange, and then how you fit into that piece, right? And that's really when you're talking about healthcare positioning, that's what it is. You're identifying that economic buyer, how your value proposition solves a need for them, and then also doing at the same time making sure you're not alienating maybe the end user or the person on the receiving end of your tool, your software, your device. So it's a nuanced thing that requires kind of looking at those four Ps and kind of how you're offering your product or service, your healthcare service or treatment kind of fits into all of those, and how you would communicate the value that each one of those stakeholders is desiring from you as an organization.
Okay, so I'm hearing that you might want to pay more attention to communicating your value, particularly to the payer in the equation. So that begs the question in my mind, what do the payers care about? What do they see as valuable that you should be communicating to them?
Yeah, it's going to depend on kind of what specifically your service is or your treatment is. Ultimately, though, like payers are worried about clinical effectiveness, I mean, it is about money and margin. So they're looking at decreasing the cost or the outlay of their spend in healthcare, but they're also looking at not sacrificing the quality of care or the clinical outcomes. So it doesn't do, Blue Cross Blue Shield any good to save $100 million. If, on physical therapy, for example, if it means they're going to spend $200 million on orthopedic surgery because they're limiting the amount they're paying for physical therapy, right?
I
So
see.
it's for buyer for the payers in particular, those are the kind of what you're looking at. You're like the quality of care, the clinical outcomes, and then the cost to the system, and making sure that it's a positive ROI for the payer.